My name is Dr. Amankoma Buedu. I'm a psychiatrist and the Deputy Director responsible for mental health for the Ghana Health Service. I have been in the mental health space for 13 years. My main motivation for being in mental health, from hindsight, is that it was a quest for answers, for solutions, to seek an understanding of what people with mental health and neurological challenges go through, as well as their family members, and to find support for these individuals. Over the last 13 years, I have been privileged to contribute to mental health in a way that makes me fulfilled. For instance, I have had the privilege of being part of the mental health specialist outreaches, which were services that we rendered to people in the hard-to-reach areas. At the time, we had just a handful of psychiatrists in the country, and most of them were in Accra and Kumasi. And through basic needs, I was able to go into the other regions, providing support for these individuals who had challenges. Another of the things that I will talk about as an achievement has been contributing to advocacy for mental health. Over the years, I have served in various capacities at the psychiatric hospital, Accra Psychiatric Hospital, and even in my capacity at the Ghana Health Service as well. So I have contributed in advocacy for mental health. I have contributed to the development of policies, guidelines, strategies for mental health services in the country. I must say that being at the decision-making table is very, very crucial. And for me, being able to sit at that table where the decisions were made concerning health, the different areas of health, including mental health, especially for me, is one key area that I am happy to have been able to contribute towards. Also led in capacity building of primary health care workers, such as medical officers, physician assistants, nurses, midwives, public health nurses, all the cadres of nursing, to be able to identify, manage and refer common mental, neurological and substance use disorders based on their level of expertise. This is very important because we have just a few number of specialists, mental health specialists, and therefore there's the need for us to be able to identify these cases as people come into the health facilities, knowing very well that mental health cuts across. I have also contributed to integrating mental health in specific condition programs such as HIV, TB, NCDs. This is very important because these groups of persons have a higher vulnerability of having a mental health condition due to the primary illness. In line with the International Women's Day, which is a day set aside to acknowledge and appreciate the successes of women, where I would want to take the opportunity to highlight a few challenges that predisposes women or girls to having mental health challenges. So females naturally are predisposed to having mental health challenges for various reasons. By our nature and culturally, there are some expectations of us as women or girls, which puts us at a higher risk. So, for instance, a girl child is treated separately or differently from a boy child, which ends up, with the girl child developing low self-esteem. that in itself is a risk factor for developing mental illness, one form of mental illness later on in life. As we develop through adolescence, we go through the menstrual cycle, which also poses as a risk factor to us developing one or the other form of mental illness. As we develop further as women, carrying pregnancy, giving birth, and then taking care of the baby and the other members of the family also has its own challenges that predisposes women or girls to developing one form of mental illness. So even in our relationships, girls and women are more prone to different forms of abuse, which is a high risk for developing mental illness. Other challenges or risk factors for mental health problems amongst women include losses, so any form of loss, unemployment, poverty, difficult, challenge relationships, and anything that puts undue stress on a woman. In line with this, I would like to call on all stakeholders to pool our resources together to prioritize the mental well-being of girls and women. We can do this by including mental health in the training curriculum in our schools, and then our pre-service training curriculum of health workers, so they would be able to identify and manage or refer mental health conditions among girls and women. I would want us to integrate mental health care in our approach to maternal mental health care, such that we are screening for mental health conditions in our antenatal and postnatal clinics, and then in our adolescent health corners. On this special day, I would like to acknowledge all women in the mental health space in Ghana and beyond. I would like to specially mention Dr. Cynthia Soti, Prof. Pinamana Pao, Prof. Angela, Prof. Oriata, Dr. Anna Jadi, Dr. Sally Ohene, Dr. Joanna Anson. I would like to acknowledge my fellow psychiatrists. I would want to acknowledge all other female mental health professionals, such as the clinical psychologists, the community mental health officers, mental health nurses, social workers, the different forms of therapists that we work with, and every other person that I'm unable to mention. I would like to mention our caregivers, who are the backbone of the people that we take care of. And the last person I would want to mention or acknowledge is my own mother, Mrs. Faustina Ifwa-Gati-Gwedu. To all women out there, I wish you a happy International Women's Day. You are truly, truly appreciated.